Annoying redness and blotches on the face are common complaints, but how do you know when your irritation is something more than just dry skin or acne? If you are experiencing painful redness, you may be one of the estimated 14 million Americans suffering from rosacea. And here to tell us more about the condition and how it is treated is dermatologist Dr. Doris Day. Dr. Day, great to have you back on the show.
Thanks for having me.
So rosacea is something that I guess affects a lot of people. Can you tell us what it is exactly?
Rosacea is a very common condition, and we think it affects at least 14 million Americans. And the problem is that most people don't recognize that they have it until they go see their doctor, and so they're treating it as all sorts of other conditions, and those treatments can actually make the rosacea worse.
Is that because the symptoms are so vague?
Well, the symptoms are a little bit unclear sometimes. They can mimic other things. We actually call it the great disguiser. You can see several different things. Sometimes you can have just simple redness and broken blood vessels. That's one type. Men tend to get a prominent nose, something we call rhinophyma, a bumpy, bulbous nose. Rosacea can also affect the eyes, and that's called ocular rosacea. You have a gritty feeling in the eyes or lots of styes. But it can also look a little bit like acne, that you can have pimples and bumps in the skin as well. But it is different than adult acne because that's more hormonal, it's more on the lower face, and with acne you do have more blackheads and whiteheads, and that's not seen in rosacea. Rosacea does affect the cheeks, the chin, the nose, the forehead, and adult acne is really more along the lower face.
But rosacea does or can develop as we get older, is that right?
Rosacea is more of an adult pattern, and that's why some people do call it adult acne. So you start to see it in the late 20s, 30s, 40s, and for most women who get it, it does get a little bit better after menopause as well.
Are there any treatments that you do in your office?
Yes, there are great treatments. Part of what we have with rosacea is treatments that can help it, and one of my favorite things to do is something called the Athera isolase, and that helps both treat the bumps and the pimples of rosacea and the redness, and this is done over several treatments in the beginning and then just a few maintenance treatments a year.
Is it a laser or what?
It's intense pulse light, and then there's a suction component as well. It's not a painful treatment and doesn't take very long, and really helps give you great control of the rosacea.
Dr. Doris Day, thank you so much for all this great information, and for more health and wellness news, be sure to check out the health page at abcnews.com.
ABC News Now. Good to know.